Hello friends, welcome to my channel MEDSimplified. Today I will be discussing about von Gierke's disease. So let's start the video. First of all, what is von Gierke's disease? It is a type of an inborn error of metabolism. So what does this inborn error of metabolism means? These are genetically determined biochemical disorders. That is, they are present at birth and they are genetically determined. As we can see here, this is how an inborn error of metabolism arises. There is some enzyme defect which produces a metabolic block leading to pathological consequences at birth or in later life. So continuing our discussion on von Gierke's disease, this disorder was first described by von Gierke in the year 1929 as hepatonephromegalia glycogenica. What it means is hepatonephromegalia means both liver as well as kidney is enlarged in von Gierke's disease. In 1952, G. Corey and C. Corey identified the cause of von Gierke's disease as absence of glucose 6-phosphatase activity. Now, von Gierke's disease is a type of a glycogen storage disorder. Also, it is the most common form of glycogen storage disorder. Frequency of von Gierke's disease is 1 out of every 1 million births. This is the table showing the other glycogen storage disorders. Type 1 is the von Gierke's disease, which is due to glucose 6-phosphatase deficiency. Type 2 is Pompe's disease due to the deficiency of alpha-1,4-glucosidase. Type 3 is Corey's disease due to the deficiency of debranching enzyme, and so on and so forth. But in this video, we will be discussing only about von Gierke's disease. So since it is a glycogen storage disorder, let us see the structure of glycogen and its role. So glycogen is a polysaccharide, means it is having multiple subunits of a monosaccharide molecule, that is glucose, linked together by glycosidic bonds. So this is the structure of glycogen, in which we can see that these glucose molecules are joined together by alpha-1,4 linkages, and at the branching the alpha-1,6 linkages are present. Now this glycogen is considered as a storage form of glucose, and it is mainly stored in liver and muscles. So what happens is, when there is fasting state, that is in between the meals, this stored form of energy or the glycogen undergoes breakdown by the enzyme glycogen phosphorylase and gets converted into glucose 1-phosphate. Now this glucose 1-phosphate is acted upon by another enzyme known as phosphoglucomutase. This phosphoglucomutase now converts glucose 1-phosphate into glucose 6-phosphate. This glucose 6-phosphate goes to the liver and acted upon by the enzyme glucose 6-phosphatase to form glucose, and this glucose is released into the circulation to maintain the glucose levels. So this whole pathway is known as glycogenolysis. In glycogen storage disorders, there is some defect either in the synthesis of glycogen or breakdown of the glycogen. In von Gierke's disease, the defect is mainly in this breakdown pathway, that is the glycogenolytic pathway. Now let us see the genetic basis of von Gierke's disease. Von Gierke's disease is caused due to mutation in the G6PC gene, which encodes for the enzyme glucose 6-phosphatase. And this G6PC gene is located on chromosome number 17. Also, this von Gierke's disease is an autosomal recessive disorder. What this means is, in this diagram, we can understand it. If both the parents are carriers, then chances of having the disease is 25%, that is 1 out of 4. Because only when both the genes are affected, then only the child will have the disease. 50% of the children will be unaffected carriers and another 25% will be an unaffected child. So this is how the inheritance of von Gierke's disease occurs. So continuing our discussion on von Gierke's disease, it is known as type 1A of the glycogen storage disorder. It is caused by glucose 6-phosphatase deficiency, and this enzyme is mainly expressed in liver, kidneys, and small intestine. That is why these three tissues are considered as sources of endogenous glucose production in our body. This is the diagram which is showing the glucose 6-phosphatase complex. This glucose 6-phosphatase enzyme is present on the luminal side of the endoplasmic reticulum. So this glucose 6-phosphate has to enter the endoplasmic reticulum from the cytoplasm to undergo this reaction, which is done with the help of glucose 6-phosphate translocase enzyme. So in this picture we can see that if this enzyme glucose 6-phosphatase is deficient, it leads to von Gierke's disease, which is type 1A of the glycogen storage disorder. But if this enzyme, which is glucose 6-phosphate translocase, is deficient, also it leads to a similar glycogen storage disorder, which is type 1B, which is rare variant of this disease. So now let us discuss the clinical presentation of patients of von Gierke's disease. First of all, what are the symptoms in this disorder? Children with von Gierke's disease start having symptoms at the age of 3 to 4 months of age. And symptoms are mainly due to the hypoglycemia, like hypoglycemic seizures. Apart from this, child has developmental delay, or we can say failure to thrive, and vomiting, hyperventilation, etc. due to lactic acidosis. And the clinical signs include the puffy cheeks with doll-like faces and thin extremities. Okay. Apart from this, they have growth retardation and short stature. Also, they have protuberant abdomen due to reno and hepatomegaly. but the heart and spleen are of normal size. So what are the various biochemical effects in the patients of von disease? The key biochemical changes in these patients include lactic acidosis, hyperuricemia, hyperlipidemia due to increased triglycerides and increased cholesterol levels, along with decreased levels of fasting glucose leading to fasting hypoglycemia. So after seeing the clinical presentation as well as the biochemical findings in the patients of von disease, now let us see the pathophysiology or the mechanisms behind all these findings of von disease. To understand this, let us see the basic glycogenolytic pathway. During the fasting period, glycogen, which is the stored form of energy, gets converted to glucose, which provides the energy during the fasting period or in between the meals. How this happens? Glycogen gets converted to glucose 1-phosphate, then glucose 6-phosphate, and finally glucose. This is the normal pathway which operates in the normal individuals. But in patients of von disease, this last step is inhibited because of the deficiency of enzyme glucose 6-phosphatase, which causes decreased glucose production during the fasting period in these patients, leading to fasting hypoglycemia. And since it is a chronic hypoglycemic state is seen in these patients, it leads to developmental delay or growth retardation in these patients. Also, since glycogen cannot be broken down to glucose, glycogen levels increase, which gets deposited in liver as well as kidney, leading to hepato as well as renomegaly. Now, as we have seen, glucose 6-phosphate do not get converted to glucose, so this excess glucose 6-phosphate then goes into the glycolytic pathway and forms pyruvate. Pyruvate has various fates. One of this is it goes into the PPP pathway and leads to increased purine synthesis in these patients. As increased purine synthesis occurs, catabolism of these purines is increased, leading to increased uric acid levels, which is seen, and in the investigations it appears as hyperuricemia, which means increased uric acid levels in the blood. Also, this pyruvate in the presence of enzyme lactate dehydrogenase gets converted to lactate, leading to the lactic acidosis, which produces the symptoms of acidosis like deep breathing, hyperventilation, etc. This increased lactate levels also is one of the reason for hyperuricemia, because these lactate competes with the excretion of uric acid and decreases this uric acid excretion, thereby increasing these levels in the blood, which leads to again hyperuricemia. So this is the mechanism for hyperuricemia in these patients. Now, another fate of this pyruvate is it gets converted to acetyl coenzyme A, and since acetyl coenzyme A excess is there, it cannot be handled by the Krebs cycle, so it gets diverted to all the other pathways in which it is acting as a precursor molecule like cholesterol synthesis, fatty acid synthesis, and ketone body formation. So all these components are increased in these patients, leading to hyperlipidemia in these patients. And due to the increased ketone body, so how this von Gog's disease is diagnosed? As we already seen the symptoms of von Gog's disease, if the child has the symptoms by the 2 years of age, like hypoglycemic seizures or other manifestations of fasting hypoglycemia like growth retardation or failure to thrive, along with abdominal protuberance due to hepatomegaly, renomegaly, as well as symptoms of acidosis like vomiting, hyperventilation, and respiratory distress. And in the biochemical test, child has decreased glucose levels, increased uric acid, lactate, as well as triglyceride levels. Then the provisional diagnosis would be von Gog's disease. Other differential diagnoses for von Gog's disease include other glycogen storage disorders. Now, the confirmatory diagnosis is done by doing the liver biopsy with electron microscopy and assay of glucose 6-phosphatase activity in the liver tissue. Also, genetic testing can be done for confirming the diagnosis. For genetic testing, we see the G6PC gene mutations. If it is present, then also the diagnosis is confirmed. Coming to the treatment part, so how this von Gog's disease is treated? There is no definitive treatment for this disorder. We will discuss the various modalities like medical management. Medical management is basically aimed at the symptomatic relief. Like medications like allopurinol are used to manage the hyperuricemia. Then there are certain medications which are used to manage the acidosis in these patients, along with fluids as well as oxygen for the respiratory distress. Apart from the medical management, dietary and nutritional adjustments are also made, like frequent meals with complex carbohydrates like cornstarch is crucial to prevent the hypoglycemia, along with balanced hypercaloric diet means excess calories are given to the patient that helps reduce the metabolic disturbances and manage the growth irregularities. In severe cases, we can go for the surgical management also, which include liver transplantation, which is considered for the symptomatic relief. So this was all about von Gog's disease. I hope you liked the video. Thanks for watching. Do like, share and subscribe my channel. In the comment section, do let me know what next you want me to discuss.